My name's Hank. I'm from Greer.
And Hank, what kind of problems have you been experiencing?
My knees, they used to lock up where I couldn't stand, or particularly after I'd been sitting for a good while. When I'd stand, the knees wouldn't follow.
Wow. So were you having problems walking?
At times I did, a lot of pain. I mean, clinically, I'm not supposed to be able to walk. Both knees are bone on bone.
Wow. So what was the first thing you did when you realized you were experiencing pain?
In terms of coming here.
Or did you go to another doctor first, or?
Yeah, at one point I got the left knee, I think it was. I had it scoped, arthroscopic surgery. Mm-hmm. That didn't do any good. It was very, very temporary. Then I started getting swelling behind the knees. My wife is really big on finding alternative methods rather than strictly traditional modalities. And she had heard about a treatment called enhanced platelet therapy. And so we looked around, and Dr. Schwarz was the only one in this area that we knew of who was doing that, and that's how we came here first. So he did a synthetic, viscous fluid that lets the knee, lubricates the knee.
Yes.
He did that in each knee first. We got immediate results. And then he did the platelet therapy. And from then until about a month ago, I had not only did I have much less pain, much easier to walk, but the knees didn't lock up.
That's great. And so what are you in here for now?
Well, I'm kind of excited. We're going to try the stem cell therapy, where they'll harvest my own stem cells, inject them into the knee with a growth media to follow it, and then we'll go from there.
Awesome. And what are you hoping to get from this procedure?
Well, I'm one of these guys who does not want replacement knees. I don't think replacement knees are for people who are still jumping on and off of bulldozers and climbing trees and running up and down hills and hunting and so forth. This is what I'm hoping to do, is to avoid replacement knees. And as Dr. Schwarz puts it, I'm actually going to grow a new knee.
Nice. And tell these folks, other people that are experiencing similar pain, what would you suggest they do?
As a general proposition, I
yes.
think you've got to have the hydration, lots of hydration. You've got to have the nutrition. So some of it's going to require some lifestyle changes. Some of the heavy fats and the other stuff that are supposedly are bad for you but taste so good. You're going to have to at least moderate, if not give up. At least moderate, and you have to find a doctor with whom you can team. As my wife says, you have to take charge of your health care. But to do that, you have to have a doctor with whom you can team to accomplish what your goals are, rather than what a book says needs to happen for you and for your age or your circumstance. You still get to decide what you want to happen. You have to find a doctor who has the skills and the ability and the willingness to go along that road with you.
So is Dr. Schwarz that doctor for you?
Oh, definitely.
So tell us why you like Dr. Schwarz.
Well, I like him personally. We've known him for quite a while, though I had never treated with him up until a couple years ago. But when I came in, I told him I'm not interested in replacement knees. He says, well, and he didn't just say, well, okay, then don't have to worry about it. He says, well, let's see what you've got first. So he's very thorough in terms of the diagnostic testing, so that what he's treating is actually what's going on, and he doesn't have to guess at what it is. He's very thorough in doing that. And then his philosophy incorporates, let's say, alternative medicines. Like, for example, the enhanced platelet therapy. As I understand it, the body wants to heal itself. And so when you get an injury, the body marshals forces. Part of that is your own stem cells. But there's some injuries are too much for the stem cells you have available. But there's a process he does where he chemically irritates, for example, a ligament. And that causes the body's own forces to come to try to heal that ligament. I think that's part of the reason I'm walking is what I do today.
That's awesome. And tell other people why they should come to Dr. Schwarz.
Well, he's a great person, which is kind of important to me, but he's also a great doctor. He understands the healing process. He understands pain management. He knows that, for example, in my case, I don't want a bunch of drugs. And so the only chemicals we've used are the chemicals involved in the actual treatment of the legs. But in terms of the pain management, we've done that by way of these treatments, by exercises, and by stretching. So it's been very, very effective. And he's also been able to accommodate my schedule as well.
That's great. So do you think Dr. Schwartz's procedures are the reason you're able to walk right now?
I don't have any doubt. As I told you, on film, I'm bone on bone. I'm not supposed to be able to walk. There was a time when literally my wife came home and had to help me get out of the car because it just would not unlock. I think because of Dr. Schwarz, I'm able to walk today.